thank you for joining us for a discussion of our Medication Monitoring Program Essentials Guide. This is newly updated and now available through your local Aegis representative. Whether you already have a protocol in place or are looking to put one together, the information in this guide will be a great starting point for considering what is best for your practice's protocol. Before we begin, I want to emphasize that the information and resources presented in this webinar are intended to educate stakeholders on the purpose and rationale for drug testing in various clinical populations and to provide actionable tools to maintain appropriate drug testing practices. This webinar is for informational purposes only and not intended to replace or supersede a clinician's judgment or assessment of individuals in their care. The ultimate decision of who, when, and how to test individuals for appropriate and inappropriate drug use remains at the sole clinical judgment of the clinician. A medication monitoring program can provide several clinical benefits for a practitioner. It helps with standardizing risk assessment and stratifying risk across a patient population. It helps answer questions about recent medication and substance use, like has the patient been taking the medication that is prescribed for them? Have they taken any non-prescribed medications? And this could mean a couple of different things, whether it's inappropriate continuation of a prescription medication that was stopped or changed, like after a transition of care, such as a hospitalization, or is it use of another person's prescribed medication or prescription medication that they otherwise inappropriately accessed somehow. Medication monitoring can also help educate the patient about adulterants that are present in the illicit drug supply and can help them understand the unpredictable risk. And all of this information can help clinicians make more informed prescribing decisions and help educate their patients about their medication regimen and risks associated with non-prescribed medication and substance use. Considering all the requirements related to controlled substance prescribing and monitoring, this process may be more safely accomplished with the use of a medication monitoring protocol. In addition to the benefits that we have already described regarding medication use evaluation and standardization of risk assessment, a medication monitoring plan or protocol also helps practitioners ensure that the appropriate regulatory and clinical guidelines are being followed as part of the patient care plan. Understanding testing methodologies is important because the results provide different information depending on the methodology used. Each method does have a role in clinical care, just that providers should be aware of the advantages and considerations of each type of testing. Presumptive methods, such as immunoassay testing or point-of-care testing that a clinician may perform in the clinic, function based on the binding of a drug to the test antibody. With this type of testing, cross-reacting compounds may result in a false positive result, and conversely, a lack of cross-reactivity within a particular class of drugs may result in a false negative result. The extent of cross-reactivity across a drug class or to other cross-reacting compounds may vary depending on the immunoassay that's being used. For instance, pseudoephedrine may have cross-reactivity with methamphetamine, resulting in a false positive result on presumptive testing. While presumptive methods are typically rapid, less expensive, and do not require extensive training to perform, the results are not definitive and are therefore subject to false positive and false negative results. In contrast, definitive methods identify compounds based on their unique chemical properties. Chromatography separates compounds, and mass spectrometry identifies the presence of specific analytes based on the unique molecular mass and ion fragmentation pattern of each substance. Definitive methods have a reduced risk of false positives and identify drugs and metabolites that may be missed by presumptive methods. While definitive testing takes more time to complete and requires specially trained scientists to perform the testing, it does provide clinicians with clinical confidence in the results. Again, each method does have a role in clinical care. This is just to help clinicians be aware of the advantages and considerations of each type of testing. Generally, if a clinician is reviewing the results of presumptive testing and trying to determine if definitive testing might be needed, it could be indicated when the presumptive results differ from what the patient is self-reporting that they have taken, whether that be medications that they've taken or other substances that they have used, or if the presumptive testing is negative for the prescribed drugs, if it's positive for non-prescribed medications, and or positive for alcohol or illicit drugs. Any of those scenarios would be guideline-supported reasons to consider definitive testing. An understanding of the difference in specimen types is also helpful, particularly when interpreting unexpected results. Urine, oral fluid, and blood each provide different information that is unique to that specimen type. For example, urine typically has the highest concentration of substances present and the longest period of detection, but the potential for urine tampering or patient inability or resistance to providing a urine sample may necessitate oral fluid testing. Oral fluid testing allows for direct observation of the patient. It eliminates the need for a patient washroom. However, it does have a shorter period of detection than urine. Blood is not subject to tampering but is invasive and unfortunately has the shortest period of detection of these three specimen types. Additional specimen types may also be considered according to the clinician's assessment of appropriateness, and clinical resources from the testing laboratory can also help further educate practitioners regarding result interpretation and the impact of the selected specimen type on the result interpretation. Numerous assessment activities can also provide valuable information about the patient's clinical status and history to help further inform the clinical picture. These assessment activities can also help with toxicology result interpretation if deemed medically necessary by the clinician. Such activities could include a physical examination, a review of the State Prescription Drug Monitoring Program or PDMP, pill counts, or formal risk assessment tools, just to name a few of what you see listed here. Multiple guidelines discuss the use of formal risk assessment tools with many options available to providers. These can help at baseline and also as a periodic reassessment tool to see if a patient's risk level might have changed over time. No single tool is specifically recommended by the guidelines, but practitioners are encouraged to use one or more of these tools. The sensitivity and specificity of the tools should not be overestimated, and there is still partially a subjective element to the overall risk assessment of a patient. Documentation is also very important according to many of the guideline recommendations. Things like indications for drug testing and anticipated patient management decisions based on the results are two aspects of many that can help comprise great documentation associated with patient care and the medication monitoring protocol. Records are advised to be current and be maintained in a readily accessible manner for review and are very critical when service is denied by a payer. Documentation should meet all regulatory and payer requirements, and it can be extensive. As you see, there's quite a list of suggested elements to include. Providers should also reference any state medical board guidance to ensure compliance with those requirements as well. And again, many aspects of documentation can help with toxicology result interpretation as well, such as being able to reference toxicology results against what is seen on the PDMP, what the current up-to-date medication list has on it, the pharmacy information as well in case there's a need to get additional information from the dispensing pharmacy. And so there are many elements of documentation that can help with toxicology result interpretation and also many other elements of documentation that are recommended by the guidelines as you see on the screen. The patient-informed consent and treatment agreement process is an educational discussion for the patient and helps establish that two-way communication between the practitioner and the patient. And so we'll talk a little bit more about each of these documents, the informed consent and the treatment agreement. The informed consent process walks the patient through the risks and benefits of opioid therapy or other controlled substance therapy, including the adverse effects, potential for development of tolerance and physical dependence, drug and substance interaction risks, the potential for impaired motor skills, the possibility of developing opioid or substance use disorder, and the potential for overdose and death. The informed consent process also educates the patient on prescribing policies and expectations regarding refills or lost medications and conditions that can result in changes or discontinuations in therapy, as well as proper expectations of treatment and the limitations of therapy. Treatment agreements are discussed by multiple guidelines and address the responsibilities of the prescriber and the patient. The treatment agreement can also include the patient's agreement to random drug testing as deemed medically necessary by the prescriber, and it can also serve as an ongoing monitoring tool for compliance with the terms and for changes in risk status, as some patient behaviors may be outside the parameters of the treatment agreement and could indicate a change in risk. Treatment agreement examples can be found online through resources like the Food and Drug Administration or from some publicly available guidelines that may contain examples, or in some cases, they may be collaboratively shared by practitioners if desired, and this can help other clinicians in creating their own treatment agreements for their practices. Elements that may be included can be things like treatment goals, instructions for safe medication use, expectations regarding where prescriptions should be obtained, like sticking with one patient-selected pharmacy, how prescription refills will be handled by the practice, safe storage and disposal of medications, agreement to drug testing, and the clinician or covering clinician's availability. There are various types of monitoring activities that may be considered as part of a protocol, and they're generally determined by the patient's risk of substance misuse and results of some of the assessment techniques that we've been talking about. Guidelines generally agree to include assessment and documentation of pain severity and functional ability, progress toward therapeutic goals, presence of adverse effects, and clinical assessment for the presence of aberrant drug-related behaviors, substance use, and psychological issues. Drug testing is addressed by guidelines and organizational statements as a component of continuous monitoring. Drug testing results may show adherence or non-adherence to prescribed therapy, non-prescribed or illicit substance use, or possible reasons for intolerance to prescribed therapy or reduced response or dose escalation requirements. However, the frequency with which drug testing may be deemed appropriate is associated with greater variation within the guidelines. It's heavily dependent on the provider's clinical judgment as well as relevant payer considerations. It is important for practices to consider their payer mix and any specific payer requirements when incorporating drug testing into a medication monitoring protocol. This slide provides some examples of guidelines and organizational statements and their recommendations regarding testing frequency. As you can see, there are a range of recommendations that are presented, and some guidance is more specific than others, while some guidelines reference clinicians utilizing their professional judgment on how often testing is medically necessary. There may be additional guidelines and regulatory requirements a clinician wishes to consider in evaluating testing frequency. Like the previous chart, this one outlines guidelines and organizational statements and their recommendations regarding drugs to include in testing. Again, we see a range of specificity in naming drug classes or guidance related to testing for prescribed and non-prescribed drugs. The decisions about what to order for testing for a patient can fluctuate over time for the same patient, can fluctuate from patient to patient as a patient's risk status changes, and also according to what a clinician deems medically necessary based on their judgment to include on the order. When it comes to applying the results, drug testing should not be the sole determinant of an individual's substance use. One abnormal result should not be the sole basis for changes to prescribed medications. Drug testing should be supplemented with conversations concerning medication use, the individual's self-report of medications taken or drugs used, and other assessment and monitoring methods. Results that suggest opioid or substance misuse should be discussed with the individual with a positive and supportive approach, and any significant or unexpected results should be reviewed with the testing laboratory. The information discussed today has a significant impact on clinical care. The clinician utilizes their professional judgment in incorporating guideline recommendations, discussion of results with the testing laboratory, and the individual's history and current presentation in making clinical care decisions. The various aspects of protocol development help to streamline inclusion of this information and provide a robust approach to medication monitoring. Here are the many references that help support the information that was discussed today and also supported the creation of the Medication Monitoring Program Essentials Guide. And I want to thank you for joining us for a discussion of this guide. Again, this is available through your local Aegis representative. If you have any questions or need to get in touch with who would be the representative for your local area, please reach out to us at info@aegislabs.com. We'll certainly get you in touch with the right person and provide more information as needed. But this concludes today's webinar. And again, I thank you for joining and hope you have a great rest of your day.